So good evening, everyone, and welcome to this evening's Fireside chat. This will be our 185th chat in this series. And this evening we'll have an interesting topic on matters ESG, in full its environmental, social, and governance. And we'll be looking at ESG in nephrology. Before I proceed, I'll just introduce myself. I'm Dr. Yuri Okech. I'll be co-moderator for this session. I also have another co-moderator by the name Sheik, and I can just probably introduce him for a bit. He's an ESG panelist with over 15 years of experience. He currently works as a senior ESG manager at Africa 50, where he oversees ESG and development impact aspects as part of Africa 50 investments and activities throughout the continent. Prior to joining Africa 50, Sheik worked as an ESG advisor for African Infrastructure Investment Managers, which is a private equity fund member of the Old Mutual Group, where he was overseeing ESG aspects as part of AIIM investment activities in West and Francophone Africa. Sheik previously worked as an ESG consultant, specialized in environmental and social impact assessment and management, advising projects under development in various sectors, including mining, energy, agriculture, etc. He also accompanied clients such as international financial institutions in environmental and social due diligence and monitoring of their projects in West Africa. He holds a master's in science in environmental sciences from the Institute de France at Sheikh Anta Diop University in Dakar, Senegal. He has a master's degree in wetlands management of the University of Ouagadougou in Burkina Faso, and a Bachelor science degree in environmental engineering of the Hassan University of Casablanca in Morocco. So before we proceed, I'll just let him introduce himself, just say hi to the participants before we introduce the speaker of the day. Thank you. Over to you, Sheik.
Thank you, Dr. Yuri, and thank you, everyone. But apologies for the delay, like in joining some technical issues. And just thank you for the introduction, and looking forward to the discussion. Thank you.
Thank you, Sheik. I think I'll proceed to introduce the guest speaker for this talk, and it's none other than Agnes Kimaru, who is an accomplished ESG specialist with extensive experience in leading complex sustainability initiatives and fostering stakeholder engagement. She currently serves as the ESG Senior Manager of Africa Healthcare Network. She has spearheaded transformative projects such as the innovative green dialysis initiative, leveraging on solar energy and water conservation technologies. With a proven track record in developing ESG policies, Agnes conducts environmental and social due diligence and enhancing governance systems and combining strategic planning with data-driven decision-making to deliver impactful results. Her work has significantly contributed to operational efficiency, sustainability compliance, and positive social outcomes across multiple country programs. Agnes is a holder of a Bachelor's of Laws degree, so she's a lawyer from the University of Nairobi and has completed advanced certifications in ESG and sustainability from renowned institutions like Strathmore University and the Corporate Finance Institute. She's a dynamic communicator, a skilled trainer. She is committed to driving sustainable growth and creating value for communities and organizations alike. So very excited to have this talk. I know it's one that is not commonly known to most people, and we have a lot to learn this evening. So Welcome, Agnes. The floor is yours.
Well, thank you so much, Dr. Yuri and Shik, for assisting with the moderation today. That was quite a lovely introduction, and I am humbled by it. And I look forward to having a fun learning experience with the participants. And I like how this whole segment is dubbed. It's a fireside chat. So it means that there'll be an exchange of ideas, as is common with adult learning. And hopefully we can bring in I want to say injection of fun to it to make it memorable. Seeing that most of the topics that we normally run through the fireside chats are clinical, and I am a non-clinical person. So we're looking forward to just having a little bit of a twist to the norm, and hopefully it will be something enjoyable for all of us. All right. So as we are well aware, the topic of the day is ESG in nephrology. And maybe just to give us a brief on what nephrology is, it is the study of kidneys that's specifically to do with the functioning of the kidneys, kidney diseases, preserving kidney health, and also delves into the treatment of kidney disease. So maybe for those who are in the clinical field, you have bigger or rather much more in-depth understanding of the functions of a kidney. But for purposes of today, we just have to move forward with just a very simple understanding of it. And basically, our kidney's key function is to filter out waste products created by our body's metabolism. And so in event your kidneys fail, you have to work with your kidney team and your nephrologist. A nephrologist is, in simple terms, someone who handles kidney health and kidney care. So you have to work out your treatment plan with them. And in most cases, they are likely to recommend dialysis treatments or a kidney transplant. And with our discussion today, we'll be looking at how nephrology impacts ESG and just to see the interconnection between the two subjects. So I'll start off by defining ESG, and maybe before I do that, my very able moderator, Dr. Yuri, will put in the chat a little question that I have for you on what you understand by ESG. What's the first word that comes to mind when you hear the word ESG? And that will be just a very quick exercise. And remember, again, in adult learning, there are no wrong answers. It's a discussion. Again, it's called Fireside Chat. So we're going to put the chat in Fireside Chat. So Dr. Yuri, kindly. There we go. So I have a couple of responses there. Someone said going green. Another one said eco-friendly. If you're having challenges accessing the link, feel free to put in your answer in the chat segment. Okay. Eco-friendly, global warming, environment. Lovely. Great. I don't want to spend too much time on this, but yeah, again, like we said, in adult learning, there are no wrong answers. Because the question was, what's the first word that comes to mind? So these are the first words that come to mind. I can see a lot of environment, social, governance, trees, sustainable, saving, safety during dialysis. And thank you so much for those responses. And I'll just go back to my slide and explain what it is. So ESG is the framework that is used by organizations to evaluate their impact on sustainability, ethics, and responsible management. So when we look at it, it will be an issue of prioritizing environmental issues. So this is how we impact the environment as an organization. We'll be looking at the social issues, which is how we treat the human capital, that is the communities, the employees, our partners and patients and all the other stakeholders that we have. Then we will look at corporate governance as well. And under corporate governance, ESG pretty much looks at how the company is being managed. So do we have board diversity? Do we have transparency? Are we managing our risks? Are we being ethically accountable? And now that's the part that covers the corporate governance. And that, in a nutshell, is what ESG is. Maybe we can start off with the environmental bit. And we will start off by looking at the environmental impact of dialysis. And when we look at that bit, we'll be looking at various areas. I'll start off with water consumption. And it's important to note that hemodialysis is a very water intensive and water hungry treatment that may have a negative impact on the environment because of its significant annual water footprint. To bring that into perspective, in a single dialysis session, we use 120 liters. We also use 20 to 50 liters for disinfection or sanitization. There is also 2,000 to 3,000 liters pre-treatment per dialysis center per day. This is with regards to the RO. And depending on the kind of machine you're using, we'll also have 400 liters to 1,000 liters of reject water per hour. In addition to all this, we have to put into account the water we use for quote unquote domestic use. This is the water we are using for floor cleaning, for toilet flushing, for laundry and the like. So what we like to call the domestic uses, that's another 10%. And according to the Kidney International reports, they estimate that in an average dialysis session, in a single dialysis session, we use an average of 400 to 600 liters of water per session, which is quite a significant annual water footprint. Moving on the environmental impact, we also have the area of energy. So this is the electricity that we use to power machines and other appliances. Again, to bring that into perspective, according to the Kidney International reports, they estimate that a single session of dialysis uses 3.1 kilowatt hours of electricity from the RO plant. We also make use of 2.2 kilowatt hours of electricity per dialysis machine. And again, because we have other domestic or other appliances that we use in the renal units, like the fridges, the microwaves, you'll have a HVAC system, that's the AC, and you'll have fans, you'll have the RO plant in itself. We also have to put into account the 10% of the total as what goes to domestic use. So, according to the research, the electricity consumption per dialysis session, that's a HD session, is 5.83 kilowatt hours. And that is, again, quite significant. Still on the environmental impact, we have waste generated from dialysis, and this varies. We have the clinical waste, which could be in form of dialyzers, tubing. We also have the sharps. We have contaminated and infectious waste, which could be the blood-soaked gauzes, the cotton swabs, the gloves, and the like. We also have the pharmaceutical waste, which is going to be in form of expired or unused medications, the vials, which are the containers used to house the pharmaceuticals, and also spent cleaning agents that are used in the RO plant. RO plant is the reverse osmosis plant that we use for water treatment. Still on the waste, we have packaging material, which is mostly corrugated packaging like cartons, which is used to store medical supplies. And we also have electronic waste. Electronic waste will be in the form of obsolete or damaged electronic devices or appliances like the obsolete dialysis machines, the obsolete fridge. Anything electronic that is obsolete or damaged will still fall under the electronic waste. Having looked at this environmental impact, let's now look at how we can reduce the environmental impact derived from the dialysis process. One way is through water conservation, which you can do via water recycling. So if you look at the screen, you'll be able to see some water tanks that are used to house water in a dialysis plant somewhere within Kenya. And water recycling will be quite significant in reducing the environmental impact, bearing in mind that we've said dialysis is very water hungry and water intensive. So before you're able to recycle or reuse this water, and particularly the reject water we derive from the reverse osmosis plant, you have to subject that water to a biochemistry analysis. That's a water quality monitoring test, which will be able to depict whether or not the water, or rather the uses that the water can be subjected to. So from the experience we've seen in a couple of our dialysis units, we found that the water has been okayed for toilet flushing. It's also been okayed for gardening. In a few instances, it's been okayed for laundry. However, I have to give you the caveat that in event you choose to use the water for laundry, you have to soften it because it becomes hard water being produced as reject water. So you'd have to use a water softener to reduce the impacts of hard water performing laundry, which would be that you will use a lot more soap if you're using hard water. Again, you'd have to make sure that you have efficient water treatment. So basically, you need to make sure that your RO plant is in good working condition. It's being regularly maintained. Your biomedical engineerings are doing frequent inspections of your RO plant to make sure that it's working as it should in an optimal level. It's just the same way with a car. If you perform regular service on a car, you are able to ensure that it serves you for a much longer time and more efficiently. Still on efficiency, we'll now look at energy efficiency. And energy efficiency can be achieved through using energy efficient equipment. So making sure that the equipment you are using has an Energy Star rating. It could have an eco mode energy efficiency rating. And this also applies to the HVAC systems that we have for temperature regulation. We have to make sure that they are energy efficient. And this goes to say that we can also ensure that we are able to get much more from the equipment that we are using. Even if you look again at cars, I like going back to the example of cars because I am a motorhead. Even if you look at cars these days, we have energy efficient vehicles, which are very eco-friendly, and the same applies to electronics that we use even in the process of dialysis. We need to make sure that even the fridge we are using to store our medical supplies is energy efficient. We can also integrate solar power. So this is through a solar system where you have solar panels on the roof to be able to harness the energy from the sun. And studies have shown that if you use solar energy, you're able to achieve a reduction in electricity costs by up to 30% or more. Of course, this is highly dependent on how you maintain your solar panels. So that means they have to be regularly cleaned, they have to be regularly maintained to make sure that you're getting the best out of them. And yeah, so solar power integration being a renewable energy source is also a very innovative way to reduce the environmental impact derived from the dialysis process. And as we've mentioned previously, it's important that we conduct regular equipment maintenance to make sure that we are getting optimal performance from all of our electronics. Another important approach would be waste reduction and management, as well as resource optimization. So here we will make use of recyclable materials and sustainable packaging. So for the recyclable materials, you can be on the lookout for the recycling sign, which you can see on the left of my screen, bottom left. For sustainable packaging, be on the lookout for FSC packaging logo on the packaging material. So with the FSC stands for Forestry Stewardship Council. And what that means is that the company manufacturing your packaging material commits to afforestation and also commits to be a sustainable source of paper. And looking at paper being something that comes from wood, if someone is, or rather a company is FSC certified, they have committed to plant 1 tree for everyone that they have cut. So that ensures sustainability. Still on waste reduction, we can ensure we have proper waste management procedures. This can be done through proper segregation of waste, because with segregation, we are able to boost chances of recovery of waste, and also we are able to boost chances of treating the waste appropriately. So ensure all bins are color-coded and lockable. Ensure that waste is disposed regularly and the bins are not left overly full. From a legal perspective, it's important that you retain copies of the waste management licenses. So here, there are different licenses that you need to make sure you retain. So the license to transport the waste, the license to transport waste, which normally comes from the environmental authority. Also make sure that you keep a tracking document, especially if it is hazardous waste, such as the highly infectious and the infectious waste that we have in our healthcare facilities. And this indemnifies you from any subsequent liability that may come into play. And of course, in addition to those licenses, you have to have an SLA. An SLA is a service level agreement. So the service level agreement is the link between you and your waste handler, and it helps with shifting the liability from you as the waste producer to the person you have contracted to manage your waste. So essentially, keep a waste management file with all these documents to cover yourself and also to meet your responsibility as a waste generator or a waste producer. And maybe just to mention, especially in Kenya, the whole producer responsibility is becoming a whole big agenda, and we need to be we need to keep abreast of the new legislation, like the Sustainable Waste Management Act that was passed into law, to make sure that we don't go against the legislation that has been passed in the countries. Another way to reduce and manage the waste and optimize resources would be proper supply chain procedures. So basic principles like FIFO, which stands for fast in, fast out, proper storage practices, those can go a long way towards reducing waste, because if you are storing things properly in your storage rooms, in the dialysis centers, things are well racked, things are well organized, you have put into account the FIFO, so you have reduced expiries. We are able to reduce waste, because you need to remember that at the end of the day, even these expired pharmaceuticals still end up being waste, as they can't be used. Another way to reduce waste and manage it would be innovation. So under innovation, this is pretty much various initiatives towards reducing waste, such as waste treatment. And in my next slide, I'll be able to show you one of the innovations that's now within the handling of biomedical waste. I'll just move to next. And maybe as I do that, Dr. Yuri, you could kindly share the video of how this machine works. It's called the Integrated Sterilizer and Shredder, ISS in short, which is a steam sterilizer with an integrated shredder designed for the conversion of biological infectious medical waste. And this machine is actually compliant with EU and WHO recommendations. It normally processes about 150 kilos of biomedical waste per hour. And this waste can be in the form of sharps, dialyzers, paper, cloth, plastics, glass. And once this biomedical waste has been shredded, the volume of the total waste reduces to 20% of its original volume and size. And again, through this shredding, the steam penetration becomes better overall and assists with sterilization results, which are much needed towards treating this waste. And on average, using this ISS machine, a normal cycle, think about like a washing machine cycle, would take 15 to 35 minutes. And once you input your waste in the machine, which is on the bottom left, you end up with the product, which is what you can see on your screen in the bottom right. Yes, so Dr. Yuri, I trust that you've been able to put in the video for them to watch once we are done with this session. It will give you like a better understanding of how the machine works. And it's just part of the various innovations that have hit the healthcare industry towards managing waste. You have to remember that one of the most common ways of managing waste in healthcare is incineration, but incineration already has its own environmental impact because we have emissions which go to the environment through the stacks, and that's chimney of the incinerator. But through using a machine such as this ISS machine, the integrated sterilizer and shredder, we are able to reduce the environmental impact to quite a significant degree. And now I'll show you from the many or few audits that have been able to carry out in a couple of hospitals and dialysis units. I'll show you some common mistakes. Maybe you are here, maybe it's from your hospital. So just be on the lookout for it to see common mistakes we make with waste management in healthcare and particularly dialysis. So top left, we have an overly full bin. Yes, the waste is lined, but the bin is overly full. So like we said, regularly empty the waste bins. Next to it, we have exposed infectious waste, which goes against everything IPC. Again, IPC is infection prevention and control. Right next to it, we have waste bins that have been left open. This could be a supply chain issue. Maybe the dustbin quality is not good, so even the end user is just using it as it is. And that's why it's important that you report any incidents to do with poorly functioning items that you're making use of in your dialysis unit. On the bottom of the screen, we can see a bin without lining, which is also wrong. Of course, there are so many regulations towards the ban on plastic, but there is also biodegradable waste lining, which has been approved by the various environmental management authorities, which you can use to line your waste to make it easier even for the person coming to collect it and dispose it to do so properly. Next to it, we have a sharp box, which is used for disposal of sharps. It has been left exposed. Normally, it's quite well closed, but here we are seeing an instance where the sharp box is exposed, which can be extremely dangerous to those, again, disposing this waste or collecting it. Then bottom right, we have waste that has been stored in the corner. Now, I know especially in the dialysis units, we have a lot of packaging material. We have the jerry cans, we have the cartons, and you even have bags from various constructions and renovations happening within the clinic. It's important that we don't fall into the trap of the bottom right of storing this waste in a corner. Make sure it's disposed in the right way and that it's done regularly so that you don't have accumulation of waste. Because again, accumulation of waste also comes with more problems to you as those who are residing in the dialysis unit or running your day-to-day operations in the dialysis unit. So don't fall under these traps and don't be one of those who are having these bad habits. Okay. I don't know if there are any pressing questions on the environmental bit, as I'd like to move to social impact. Dr. Yuri?
There's a question from Dr. Amar, but I believe we can take it at the end.
Okay, no problem. Right, so I'll move on to the social impact of dialysis. And again, as I had mentioned earlier, social impact is to do with the human capital, how we are treating people, how we are treating our patients, how we are treating our various stakeholders, our partners, and the like. So what is our social responsibility as people in nephrology, or as people who conduct dialysis? Number one is patient access to care. So this can be achieved through geographical distribution. Look at the underserved communities. Do they have access to a renal unit where they can have their kidneys tended to in event they have issues with their kidneys? Look at healthcare equity, a big topic right now, especially in Kenya, now that we have the new legislation regarding the Social Health Authority and the Social Health Insurance Fund, which has now taken over from the National Health Insurance Fund. Is there the principle of healthcare equity? Can everyone access healthcare if they require it? So as a dialysis provider, it is our responsibility, our social responsibility, to ensure that our patients have access to care. And I'd like to commend AHN because with all this limbo of the new Social Health Authority replacing NHIF, they were able to reach out to their patients and actually take it upon themselves to register their patients under SHA and SHIF, making sure that our patients don't miss a dialysis session, which can be detrimental to the overall patient outcome. So kudos for that, AHN and all the other organizations that perform dialysis, for taking a step forward towards ensuring patient access to care. Because I'm sure you saw from the tabloids and from the news where patients were being turned away from dialysis care that they desperately needed. So taking that, going the extra mile and helping patients register so that they don't miss a session, that is quite commendable and a step in the right direction towards social responsibility. Still on social responsibility, we have to ensure staff well-being. This can be achieved through employee engagement and professional development. So on employee engagement, this is making sure that you become the employer of choice. So being the employer of choice means that your employees are happy to be there, and you can engage them through team building sessions. You can also engage them through something as simple as activities that can be done regularly. I'll give an example again, that's usually something done in AHN. Every Friday, we have a segment that is dubbed Theme of the Week, which was the brainchild of one of the country directors as well as the HR team. And basically what happens is that every Friday from 4 to 5, we have a roster whereby a specific department runs the 1 hour of bonding. So they have quizzes, they have puzzles, it can be a riddle. It's just something that brings us together for that 1 hour. You know, after a long week of dealing with so much professionally, it's always good to be able to unwind and bond. And, you know, even in that particular forum, you have leaders there. Most times you'll even find the country directors there. You'll find the CEO there. You'll find the senior leadership team there. And they become very approachable for you to be able to even just, you know, bounce off an idea on them, or even just bond with them and get to know them better. And even the employees are able to meet and know each other because, as you know, in a normal dialysis operation, you'll have like a corporate support team and you'll have the center teams. So normally the corporate support team are inside the office, and then you have the center teams which are in the dialysis unit. So chances of them meeting are not as frequent as you'd want. And such a segment like Theme of the Week enables that employee engagement and team bonding. On professional development, a bunch of these careers that support dialysis require the CPD points, and I'm sure Dr. Yuri can speak more on that. So like, for example, if you are a HR, you need CPD points to continue practicing as a HR, and the same for finance and other professions. So as an institution, it is important to provide the necessary support to your professionals towards advancing their careers. If there's a seminar they can attend, let them attend it. At the end of the day, the knowledge that they gain from these sessions will, at the end of it all, come to benefit the organization. So professional development also ensures staff well-being and making sure that you become an employer of choice. Still on social responsibility, we have quality of care, and this is through excellence in patient care delivery. So you can be able to know how you are faring under quality of care through patient satisfaction metrics. So you can have a patient survey to get insights from the patients, understand what is working for them, where you need to improve, and any ideas they may have. Sometimes the patients have very brilliant ideas, and being that they're the ones on the dialysis bed, they are the ones who really understand what they go through as a dialysis patient, or rather as a kidney disease patient, and it's important to also just get it from them. Another thing that's very important under quality of care is patient engagement. This is actively engaging with your patient. I know from previous fireside chats, we've had speakers coming in and giving the ideas of exercise while you undergo dialysis. It can be something as simple as providing a stress ball whereby the patient can just squeeze onto it, and just that action of squeezing onto the stress ball is a form of exercise, and it breaks the monotony of a dialysis session, which takes 4 hours. And yeah, it's our level of patient engagement. You could also celebrate your patient's birthdays. So if your patient has a birthday, nothing is stopping your nurses from coming in with a small token and just wishing the patient a happy birthday. Because remember, dialysis is something that you'll be undergoing a minimum of twice a week, in some countries, thrice a week. So it becomes like kind of a second home, and you need to make sure that they feel at home when they're at your clinic. So engage with your patient. Sing for them happy birthday when it's their birthday. But of course, look at various social issues to do with diversity, equity, and inclusion to make sure that you don't offend patients based on their religion and their beliefs. But yeah, patient engagement is something that would set you apart and would help you ensure quality of care. Also look at educational programs. Of course, kidney disease patients would require guidance on disease management. They'll require guidance on lifestyle, on nutrition. So as a dialysis service provider, it's important that you make this information readily available for them. Of course, you will make use of professionals in those fields. So like the nutritionist can come in and give you nutrition plans. And even you can go a step forward, like AHN, and have a segment such as the Fireside chat to ensure that your patients and all the kidney health and kidney care enthusiasts have a segment where they can come in and learn more about nephrology and what they can do to just make a difference with regards to kidney care. So that would actually fall under the patient support services as well, not forgetting palliative care for the patients who are in end-stage kidney disease. Another important thing to ensure quality of care is grievance mechanism. Sorry. Right. So another important item on quality of care is grievance mechanisms. Grievance mechanisms enable you to get feedback from your patients and even from your staff, from various stakeholders. This can be through a suggestion box, like a physical suggestion box. It can be through an online form, which can be filled anonymously. It can also be through talking, because we have instances where someone wants to relay a grievance verbally, and it goes a long way to ensuring that no one is aggrieved and not being heard. So grievance mechanisms are extremely important, and it's also important to keep a log of the grievances you are receiving, to be able to track the trends and also be able to track what are the common grievances and also help you to address them accordingly. Then on the next part, you need to track clinical outcomes. Of course, being that a large number of the attendees are clinical, you have a better understanding of this. So this means mortality rate tracking, catheter infection tracking, audits to make sure that the structural integrity of the buildings, the cleanliness, the housekeeping, the functionality of the machines and maintenance is being looked into. Hemoglobin and albumin levels, as well as dialysis clearance, serum, calcium, and phosphorus levels. Yeah, I'm sure that the audience have a much better understanding of clinical outcomes. But what clinical outcomes do for you, again, is trend analysis. And with trend analysis, you're able to see what is working for you and where you need to improve. Still on social responsibility, we need to look into CSR activities. CSR is corporate social responsibility, community engagement, medical camps. I know there are instances where organizations even go a step further and offer transport, because remember, we said we are going to provide patient access to care through geographical distribution. So that means that we have people in underserved communities, which could be remote areas, whereby they may not have a dialysis clinic and have to travel a couple of miles to get access to care. So in such events, as an example of a CSR activity would be to have a transport kitty for the patient to be able to reach a dialysis unit. We also have medical camps that go a long way in providing information to the community at large, and also helping with screening of patients, prospective patients. So there's people who could be unaware that they have issues with their kidneys, and through medical camps, they're able to gain a lot of knowledge and also get screened to be able to know whether they require treatment. And that's on the social responsibility. And we can't close up on social responsibility without discussing occupational safety and health. I'll just run through this real quick. So one of the ways to ensure that you are compliant with occupational safety and health would be through emergency preparedness and response, EPR, making sure that you've conducted risk assessments and planning of the workplace at large. You have communication channels in event there's an emergency. Have a scenario in your mind whereby the main hospital is on fire and people are undergoing dialysis. You need a proper communication channel to enable you to communicate with those within the dialysis unit and make sure that they are safe and that the emergency has been averted. You'll also look at drills. These are drills to make sure that you have been able to test your emergency preparedness and see where you have gaps and what you need to do better and improve. And you just have to keep on running these drills until you get it right. Again, resource management and planning. If you need water bowsers to complement the existing stored water that you have for firefighting, you need these resources at hand. The numbers of the fire brigade, let them be well displayed, let them be readily available for the fire marshals to call in event of a fire emergency, for instance. Also, it's important to take into account, as you plan for your emergency preparedness, the patient care continuity, because, I mean, the fact that we had, God forbid, fire in a dialysis unit doesn't mean that a patient doesn't need dialysis. They need this continued care. So you need to have contingency plans in place towards making sure that your patients get continued care. Look at IPC, that's infection prevention and control. Look at collaboration and coordination, because you'll need to coordinate with the main hospital and other emergency response teams. And look at post-event recovery. After an emergency has occurred, we need to know, like, how do we recover from what has happened? What is salvageable? Which authorities do we have to notify? And that will all be part of your emergency preparedness and response protocols, which is a very important plan that you need to have in place in every healthcare facility, any facility, even your own house. You just need to have a proper emergency preparedness and response plan. Still on that, it's important that you have good security. So CCTV, to be able to have remote surveillance of your storage rooms, the dialysis facility, of course, access control, particularly for the storage rooms, the warehouses where you store your medical supplies. They should not be readily accessible to any Tom, Dick, and Harry. There has to be some regulation as to who is authorized to get into certain places. So even the RO plant, even those water tanks we had seen earlier that were caged, all that is a security measure towards making sure that you don't have unauthorized personnel accessing your equipment and your supplies. And yeah, it's important to have good access control, have security guards, and just have a robust security system to be able to protect the people who are there, that's the patients, the staff, and also to protect your property. Because remember, even as we've mentioned, emergency preparedness and response, it could be an arson attack that is an emergency, and that can be shelved through good security. So security is quite important. Again, someone can poison the water in the tanks. So security is very, very important, not to scare you, but just to bring everything in perspective. Again, incident investigation and reporting is very important because it helps us identify trends and perform a root cause analysis to know what actually caused an incident and what can be done to avoid recurrence. So if it is a workplace incident, rather accident, you need to know that if it is an accident where someone was hurt but didn't die, you have 7 days to report it to the authority, that is the Directorate of Occupational Safety and Health Services. In Tanzania, it's called OSHA, which is the Occupational Safety and Health Authority. So you have 7 days to report that. And if it's a death, you need to make sure it's reported within 24 hours. Please note, I'm not talking about clinical mortality rates. I'm talking about death resulting from a workplace accident. For example, maybe there was a weighing scale that was being ferried, and while it was being offloaded from a truck, it fell on someone and they got injured. Maybe a nurse was walking around the dialysis unit and there was a wet puddle of water and they slipped and fell. That is a workplace accident. So it's important that you report those and record them to be able to identify trends and avoid recurrence. Still on occupational safety and health, chemical safety is quite significant and quite important for dialysis because remember we have pharmaceuticals, which are chemicals, the dialysate, the heparin, all those are chemicals. And it's important to segregate what is flammable, like IPA, which is isopropanol alcohol, from the non-flammables. So this is just the principle of chemical safety. Flammables should not be stored together with non-flammables because at the end of it all, if the flammable chemical was to catch fire, the non-flammable material becomes fuel for the fire, thus making the fire even bigger. Fuel for fire is what we call the food of the fire. So you don't want to make the fire bigger just by virtue of poor storage practices. It's also important that when you're handling chemicals, you use the correct personal protective equipment, PPEs, and that the PPEs you need for handling a particular chemical can be derived from an MSDS, or rather the MSDS for the particular chemical. MSDS stands for Material Safety Data Sheet. And for those who may not know, if you look at even a cough syrup, if you buy cough syrup or if you buy tablets like paracetamol, inside there's usually that leaflet guiding you on side effects, what to do if it gets into your eyes, what to do if it should go onto your skin, like on your hand or something. That is a form of a material safety data sheet. And each chemical has a material safety data sheet that gives guidelines on handling, storage, emergency preparedness if you are to be faced with an emergency situation. For example, if it gets into your eyes, if it gets onto your skin and has effects. So it's important that you have material safety data sheets for all the chemicals you're using in your dialysis unit. Still on OSH, electrical safety is important. We mentioned electrical equipment that we use within our renal unit, and it's important that all this equipment is well maintained. So you should have insulated wires, covered sockets, proper cable management to avoid trip and fall hazards, regular spotting and reporting of electrical hazards. If you see a cable that is running across a room, I know especially with these weighing scales and the wires that are usually on the weighing scales in the renal units, you find one is running from one corner of the wall to another corner. And that is a hazard in itself because someone can trip over that wire and fall. Again, leave electrical repairs to the professionals. Don't perform juakali repairs because those can end up being detrimental. So make sure that any repairs are done by a professional electrician. Still on OSH, food safety is important because in many instances we feed our patients and it's important that we don't contaminate their food, thereby bringing them food-related complications like food contamination or food poisoning. You can make sure that you have proper storage and handling practices by consulting your in-house nutritionist who can give you guidelines. For example, if you are serving your patients dairy, they can guide you on they can give you guidelines and food safety protocols for different types of food. So make use of the available resources. Consult your nutritionist to make sure that how you are handling and storing your food does not end up being a problem for those consuming it in the long run. PPEs, we have already discussed this. They have to be task specific. They have to be well fitting. So if you're using gloves, make sure they fit you well. If you're wearing scrubs, make sure they fit you well. If you're wearing medical Crocs, make sure that they are well fitting and use them correctly. So again, on Crocs, I just have to mention this because it's something I have seen as I go around doing audits. Don't bring the Crocs you use at home because the household Crocs and the medical Crocs are very different. So you might think it's just footwear, but the medical Crocs have been designed in a way to make sure that you are protected from any harm that you might face, or rather any hazard that you might face around your feet while going about your duties in the dialysis unit. And of course, make sure they are well maintained. Okay. Seem to have repeated that slide. And these are just some images of some emergency response elements you can have in your dialysis unit. So the extinguishers, what I find as I go around is that we treat extinguishers like, how do you say, decor pieces. So you have very lovely extinguishers that are being serviced by the service providers, but no one knows how to use them. So staff training on how to use extinguishers is important because if you have an extinguisher and people don't know how to use it, it becomes a decor piece. It's like that painting you have in your house or that flower, that potted flower that you have. It's good to look at, but it's not really something that's helping you in event you have an emergency. First aid kits and especially the eye wash stations where you are storing the chemicals, the storage rooms is very important. And this is normally used in event chemical splashes into your eyes. We mentioned CCTV to have a level of remote surveillance to just monitor security and any incidents that could occur in our premises. Fire alarms, very important. Those smoke detectors, heat detectors to be able to alert us in event of a fire. Of course, a fire action signage, just giving the steps to take in event of a fire in your dialysis unit or your healthcare facility. Lastly, a flammable storage cage, which you can use for storage of flammables like IPA. You can just cage them and make sure that they are segregated away from the non-flammables that you have stored. So again, I'll show you some of the common mistakes and bad habits from audits that we've been able to carry out in different hospitals and different facilities. Yeah, so there you can see a warehouse where IPA drums are stored. The IPA drums are the yellow jerry cans you can see there. Sorry, jerry cans, not drums. Are the jerry cans you can see there, stored next to other non-flammables. That is wrong, as we have seen. Again, we have unidentified chemicals, and the rule of chemicals is that all chemicals must be labeled. Even if you know what it is, you know that is surgical spirit, have a label on it. Still on that, medical supplies must be stacked properly. And there we have an image of medical supplies that have toppled over. So this can be a huge problem for those who are loading and those who are operating in a warehouse or a storage room. So make sure that you stack medical supplies properly and don't end up being caught up in such bad habits. On electrical safety, you can see from the screen, we have an open socket, which goes against the principles of electrical safety. We have naked wires. We have a fridge that is gaping at the bottom that is used for the storage of medical supplies. We have a very dangerous image there. We have naked wires next to LPG. In event we have electrical sparks next to that LPG cylinder, it can cause a fire and a big emergency, which can be very detrimental. We also have an image on poor cable management, and we've said that cables must be well managed to prevent trip hazards. We also have a damaged socket that has not been attended to, and we had said that any repairs need to be reported and handled by an electrician. Still on common mistakes and bad habits, these are PPEs that I found. I'll not say which dialysis units, but yeah, these are PPEs I found stored in a kitchen cabinet inside a carton. Sorry, the bottom image is mislabeled, but that is clinical members of the clinical team near the waste management area in Crocs, which is wrong, because that goes against IPC principles. Those Crocs will again get into the dialysis unit and can bring in IPC issues. So that's wrong, and make sure you keep away from that. And yeah, that is on the social responsibility. The last bit we'll be covering will be governance, to just give you an understanding of what that would entail. I'm nearly done, and I hope that we are still learning and still being able to just take in this knowledge. And also just have questions if you have any, I'll be happy to answer them. So on governance, what is covered under this is number one, statutory and regulatory compliance. So this is your adherence to the legal and regulatory frameworks. And this goes towards environmental compliance, health and safety compliance, basically compliance with all the various laws that we have in play, putting into account data protection. So at the bottom there, you can see a bunch of stakeholders that enforce compliance, whether it's statutory or regulatory. We have REMA, not the musician, but REMA is the Rwanda Environmental Management Authority. We have the National Environmental Management Council, which is the authority in Tanzania. We have NEMA in Kenya. Zambia has ZEMA. And we also have OSHA, which is the Occupational Safety and Health Authority. And that's the body that handles occupational safety and health in Tanzania. In Kenya, we have DOSH. DOSH stands for the Directorate of Occupational Safety and Health Services. We also have the Ministry of Health that gives us guidelines every so often. We also have the government, and there we have the logo for the Tanzanian government. We also have regulatory bodies like ILO, that's the International Labour Organization, and of course WHO, which is the World Health Organization. So it is important that to uphold governance principles, you adhere to the legal and regulatory frameworks. It's also important to have ethical accountability and transparency. This is integrity and openness in everything that you are doing in decision making. It needs to be transparent and ethical. So this means that you do not engage in corruption, you do not engage in bribery, and you don't do anything fraudulent or anything that is unethical in your operations. Risk management must be holistic. So you need to maintain metrics, outlining the risks you are likely to face in your operations. So look at each and every function. If it's HR, there's the risk of people absconding duties. You can imagine if someone has absconded duty and there's a patient that needs to be attended to, what is the contingency? So what's the probability of it happening and what's the severity of it? So have a risk management for each function, be it HR, be it finance. Finance would probably have the risk of fraud. How are you how are you managing that, and what is the contingency in event it happens? So have a very holistic risk management matrix that gives you an insight to how you manage your risks within your organization, within your renal unit, or within your healthcare facility. It's also important to look into innovation and technology for sustainable healthcare practices that mirror UN Sustainable Development Goals and other industry benchmarks. I've already shown you an example of an innovative approach towards waste treatment. So it's important that you keep abreast of any innovations and any technologies that affect our field to ensure that we don't get left behind. It's important to have data analytics and ESG, that's environmental and social governance KPIs, key performance indicators, tracking. So monitor your carbon footprint, conduct regular auditing, monitor your progress, and have transparent impact reporting. So this helps you know where you started and how various innovations and how various initiatives have helped you progress from an ESG point of view. So for example, we talked of water recycling and water use in dialysis. If you track the metrics of that, how much water you are consuming in your dialysis unit, and that is your starting point. And then you start tracking it after you've implemented recycling practices. You're able to see your progress and see how you are impacting the reduction of your carbon footprint as a whole. Still on governance, it's important that you engage your stakeholders. I think we've been talking about this. Engage your communities, engage your partners. So the communities goes towards making sure that they are educated on various community health and safety risks they might be exposed to. For example, if waste from the dialysis unit is improperly or rather poorly disposed, a child walking around the street might come into contact with a sharp, like an injection or a syringe. What should they do in event they come across it? We should just educate the community to know that that child should not play with such items and should actually not even touch it. Educating or rather collaborating with the partners, the partner hospitals that we work with, the insurance, making sure that you have very active communication with them, whereby you are able to tell them maybe challenges you're facing in your unit, and they can also give you solutions as to how to resolve it. For example, being that we said we are using water a lot, and maybe you are relying on the hospital to provide you with water, it's likely that maybe there's a water shortage and your partner hospital has a contingency measure towards resolving that problem. So active communication and engagement with the partners is important. Engaging with your employees, we've talked about that. Have employee engagement initiatives to make sure that you are the employer of choice and that your employees are happy and are serving with a smile on their face. Also engagement with investors, and yeah, we have Sheik here today who's from one of our investors, 850. It's important that you also engage with them to get to understand their requirements and get to understand what they would or rather various ways you can collaborate with them, because at the end of the day, as one of their investments, you become part of their ESG risk matrix, because there's a reputational risk based on the mere fact that they have invested in your institution. So they have to keep tabs on that. Still on governance, it's important to have diversity, equity, and inclusion. So an inclusivity culture, which ensures you have people from different religions, you have persons living with disability and they are well catered for. You have diverse perspectives and equal opportunities for all. Even from board level, you have board diversity, you have representation from ladies in very senior management positions. the gender pay gap has been addressed, all that would still fall under DEI, diversity, equity, and inclusion. And lastly, leadership commitment. So now this one is not bottom up, it's top down accountability, whereby you have accountability right from the top, where you have your ESG goals that are later now cascaded to the various functions, the various departments. So you have the overall goal in the organization, and everyone from a functional level understands their role towards meeting the corporate, or rather the organizational goal. An example would be if you have the goal of increasing access to care. HR knows that that means manpower. Finance knows that they have to provide the funds for construction of more centers to provide dialysis. If you look at IT, they know they have to have robust softwares to be able to manage everything operational that would come with growing volumes. And it becomes a concerted effort within the organization towards meeting the corporate goal and realizing it. Again, your mission and vision has to be embedded on ESG principles to make sure that you are not growing as an institution, but going against ESG principles. And yeah, in a nutshell, that is what would be covered under governance. And now I'd like to welcome questions. So over to you, Dr. Yuri.
Oh, thank you, Agnes. I think that was quite an enlightening and thought-provoking discussion. I think we need to look at our environment differently from now on. Also, our social network governance in our places of work, and even I think even in our residences. I think it applies everywhere. So
Yeah.
we'd just like to open this next session to questions. I think before I take the questions, there's just a comment by Professor Bima. I think he had to drop and commented and said, excellent talk. And he actually requested me to congratulate you on his behalf.
Thank you.
So that is Professor Bima. So I'll take the first question from Dr. Amar, who is also very humbled with the presentation, and also is happy that someone is monitoring behind the scenes of current activities in hemodialysis services on matters ESG. So his first question is what strategies can be implemented to manage and reduce the waste generated by single-use medical supplies in nephrology? So I think we'll take them piece by piece because I think it's a loaded question, 3 of them. So the first one is on strategies that can be implemented to manage and reduce waste generated by single-use medical supplies in nephrology.
Okay, so essentially, the backbone of reducing waste that is generated from nephrology as a whole is research. So having a robust research and development department to tell you what you can be able to reuse without bringing in complications with IPC, and also what you can't be able to reuse is very important. So for me, that one, I'll just say tons and tons of research to enable you to have proper, or rather a proper strategy on how best to reduce that waste. And again, as we said, sustainable sourcing is very important, because if you source from a sustainable source, you have less to worry about. So sustainable sourcing, I told you to look out for the various sustainability logos that we have out in the market. And that would just put you on track for that. Yeah. I don't know if you have anything to add, Dr. Yuri.
I think that's good enough. There's just a small addition to that question by a participant, I think called Ishan, who says, adding to Dr. Amar's first question, he would love to hear about how we can balance the usage of reusables with IPC standards.
Okay, so I know IPC is your bread and butter, Dr. Yuri. So I'll just throw that one to you, and then maybe I can add in on it.
Great. I think in terms of reusables is the way to go, because if you're able to reuse an item, the first thing is that we need to do is disinfect. So long as we have proper disinfection, if you have a policy in place on how to disinfect, to ensure that we're also doing quality checks to ensure we are doing proper disinfection, then we can reuse that. So in terms of balancing IPC, it's mostly guided by policy and then practice, and then also doing quality checks to ensure that whatever disinfection practices that are in place are actually working. So in a way, if it's an item that you're able to take a swab of after disinfection and then see whether you'll culture something or you'll probably pick bacteria or a virus from it if possible, then you'll be able to know whether whatever you're doing is actually working. And also using standardized or probably approved disinfectants so that you ensure whatever you're doing is according to best practice. Maybe taking a second question from Dr. Amar. I think the other question is, how can renal care programs address inequities in access to care, particularly for underserved, I think that is underserved, and marginalized populations or groups?
Okay, I think we had covered that to a degree, whereby we said, of course, access to care would mean having geographically distributed centers, whereby even the underserved communities have access to dialysis and kidney care. Still on that, having CSR initiatives like transportation kitties, whereby you actually chip in towards making sure that the patients have transportation to the dialysis units, which for the underserved communities is normally miles and miles away. Even medical camps, you can take the medical camp to those underserved communities so that they can get more knowledge and information about kidney care as a whole. So that would be just one way to be able to plug in on that and make sure that we bridge that gap.
Great. I think there's one last question from participant by the name Martin, asking what burning assessments should an auditor focus in regards to reviewing dialysis operations?
Okay, so from
yes,
go on.
you can take it up. Yeah, no, you can take it. It's fine.
Okay, fine. So basically, when you are auditing a dialysis unit, you have to look at different parameters. And from an ESG point of view, which is our key focus today, you have to look at consumption of various resources, like how much electricity are you using? How much water are you using? If it's waste, are you keeping records of how much waste is being generated? And how much of that is being recycled? If it's water, the same, how much of it is being recycled? You'd also look at occupational safety and health. So everything to do with emergency preparedness, the chemical safety, the electrical safety. Look at PPEs. Are the staff or rather the nurses, the clinicians wearing PPEs as required? Look at IPC. Are we ensuring that we have protocols for infection prevention and control? I'm just thinking top of my head, look at even the social aspect. What CSR initiatives are in play and how does that mirror on the overall revenue of the company? So it's quite a broad topic, and there are various tools available that you can use for ESG auditing, and they can go a long way in helping you track your ESG performance. And I hope that helps, Martin.
Yes, maybe just to add to that, Martin, the easiest way is to look at it. If you're doing an audit, there are structural audits and we have process audits. So like Agnes explained, in terms of structure, you look at how best you can improve the environment, or is it fit for purpose? Then in terms of process audits, you look at whether the teams are adhering to policy and doing what they should be doing. I think if you put focus, if you divide it that way, I think it's easier. And then the last bit is also look at outcomes. What are the outcomes of whatever we are doing so that you close the loop. I think there's a question that I missed from Dr. Amar. Just trying to look for it. I think he says he has a third question. I think my
Okay.
cursor has a bit of a problem.
Mine
Trying
too.
to. Yeah, I don't know, Dr. Amar, if you possible, you can just unmute yourself and ask. I'm unable to get the question.
I also can't see it, but I can see
I think,
Dr. Maza has his hand up in the meantime.
yes, Dr. Maza, you can proceed as I look for Dr. Amar's question.
All right, thank you, Agnes, thank you, Yuri. Agnes, that was a fantastic talk. I thoroughly enjoyed it, and looking forward for more to come from your side. So I'm going to play devil's advocate here a bit, and I apologize for that in advance. But it's not a trick question. It is something that just came to mind. So with the ESG, we want to be more environmentally friendly, right?
Yeah.
And we know that with the amount of water that is used, I mean, recycling, that is something that is done in certain situations. While I was training in South Africa, there was quite a bit of drought for like 1.5 years or so, and they were actually recycling the dialysis reject water and using it for other reasons. And obviously, this has got an impact on the environment. Now, with regards to one of the recommendations for electricity usage was that we should use solar as an alternative to electrical, supply. So my question to you is that for solar to work, we need to have batteries that we use. Yeah. And I mean, there are inverters that kind of go through and they get charged. And then when, say, the power goes off, then the batteries take over. Now, these batteries obviously, are utilized. And once they kind of end up their life, they need to be discarded. So what is your view on that and on the environment with these battery issues that are used?
Okay, so maybe first to clarify is that we have solar systems that operate without batteries, whereby they complement the electricity you're getting from the power utility company, and are not necessarily like what is being relied upon 100%. So that is one way around it, whereby it's more of a complementary energy source. And of course, on batteries, yes, we have various environmental impacts that come with using batteries, especially those that are lithium powered. And that is something that would end up now falling under hazardous waste in event that said batteries are spent. And we'd have to look into proper disposal of the same to be able to be responsible for the waste that we'd have produced by virtue of that. And yeah, so I would still highly recommend solar power as a complementary energy source while powering your dialysis units. I don't know. Sorry. Sorry. Okay, cool. I'd still highly recommend solar energy. There's even innovations that go as far as solarized RO systems that ensure that you have an RO plant that is powered by solar as well. So yeah, I do get the concern there with the batteries, but at the same time, you're looking at it holistically, and you already know that using solar can reduce even your electricity bills by up to 30%. So I feel like the benefits kind of outweigh the disadvantages of the same. Yeah.
Thank you,
I see
Agnes.
a question that has been repeated 3 times.
Yes, I think it's the last question by Dr. Amar. I think I can read it out.
Yeah,
his
go
question
ahead.
is, how can renal care organizations adapt to integrate ESG principles into their strategic planning?
Okay, so I think towards the end we had talked about corporate goals. So as you have your strategic plan for a period, maybe 5 years, you can integrate ESG principles by making sure that your ESG goals are mirrored in them. So if as an organization you have a goal to reduce your carbon footprint, let that be mirrored in your strategic plan. And have very transparent impact reporting. And that's why you see that this global, these big global multinationals always go a step further and make sure that every year they have an annual impact report that shows what their goal was and how far they have come towards meeting it. So as you're having your board discussions, as you're having your discussions with the various stakeholders, make sure that you have goals from an ESG perspective, whether it be environmental, whether it be from a social perspective. Maybe you have decided that every quarter there'll be a CSR initiative for each of your regions. Maybe you've decided that every quarter there'll be a patient engagement initiative. You've also decided that under governance, we will have a compliance level of 96% as an organization. And that would go a long way towards ensuring that our renal care organizations have ESG principles embedded in their strategic plan. I don't know who is drawing on my screen, but you can see some lines. Anyway, yes, I hope that helps answer Dr. Amar.
Thank you. I hope he's answered. I don't see any other questions in the chat box, so I believe we are coming to the end of this session. We are almost 30 minutes past the hour, so
Wow.
I believe we'll call it up. We'll close it here. So for me, I would just again want to thank Agnes for the enlightening talk. I think there was quite a lot of things that we learned today. And on behalf of Africa Healthcare Network and our panelists, I want to convey my thanks also to the participants who made time to attend. And hopefully we learned a lot. This session will be posted on YouTube, so you'll be able to refer to some of the conversations and even the slides. Or you can also reach out in case you need any assistance. I'm sure Agnes will be able to jump in and help. Before we close, I would probably just give it to my co-moderator, Sheik. I think if you have some closing remarks, over to you, Sheik.
Thank you, Dr. Yuri. Thank you, Agnes. And really, almost nothing to add. Agnes, thank you really for the 365th hour. You covered the subject very well and very appreciated. And I hope that as a session will come and go into detail, see that there's a lot to say and a lot of learning. So I think that this is, for us as investors, it is an important aspect at a company level to make sure that also ESG is shared across various departments and have these forum where we have opportunity to talk, to discuss and to share, but also to learn, because like I've learned also a lot. Thank you very much. Thank you, Dr. Yuri. Again, thank you, Agnes.
Thank you so much, Sheik, Dr. Yuri, and the rest of my panelists, and even the participants who have set time from their day to join me today. Excuse me. Thank you so much, and God bless you. And I hope that I can continue to impact knowledge on you in one way or another. So if you have any questions, please reach out and I'll be happy to assist you. Thank you.
Thank you, and wish you all a good evening.